Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. National Orientation Agency hits the road with COVID-19 awareness campaign as the nation records over 48,000 infections. And we explore Nigeria's COVID-19 risk reduction plan with the Executive Secretary of the National Health Insurance Scheme, the NHIS. And it's a race against time for travelers as UK government announces mandatory 14-day quarantine for anyone returning from France. Thank you for joining us on the program. When you wear a mask, you protect yourself and the people around you. That's the message from the Nigeria Center for Disease Control, the NCDC. The NCDC is also asking Nigerians to go the extra step by taking responsibility to slow the spread of COVID-19. Meanwhile, Nigeria's latest COVID-19 figures show that the virus is not abating just yet. 373 new cases across 19 states, and the FCT means that we have now crossed the 48,000 mark with 34,309 discharges and 966 deaths. A breakdown of the 373 new cases show Lagos with 69, Osun 41, Kaduna and Oyo 40 each, FCT 35, Plateau with 22, Rivers 19, Kano and Ondo 17 each, Ogun 15, Abia 14, Gombe 12, Imo 9, Enugu 7, Kwara 6, Delta 5, Niger 2, Borno, Bauchi and Nasarawa with 1 each. Let's head over to Akwa Ibom State, where the government is satisfied with measures put in place by secondary schools and the state governments to prepare students for the West African Certificate Examination and the national examinations in the state. The Commissioner for Information, Ini Ememobong, who spoke to journalists in Uyo, the state capital, says the state government has already constituted a monitoring team to go around schools in all parts of the state to ensure that students and teachers observe COVID-19 guidelines on the resumption of schools across the country. Channels Television visited a secondary school in Uyo where the management ensured that all teachers and students observe the necessary safety guidelines in classrooms, dining halls and hostels.
Council received from the Honorable Commissioner for Education the report on the state of preparedness of public schools at the level of reopening and preparation for YEMI examinations. Council directed further that those satisfied with the present level of preparation, that increased supervision and monitoring be undertaken. Gentlemen, those are the issues that we discussed today and agreed.
We're expecting to write the exams ever since, but we're a bit delayed. All the anxiety, everything. But I'm happy that we are back here to write the exams now. And I'm expecting everything I prepared for to come to pass.
Well, the National Orientation Agency has launched a mega motorized awareness campaign on the coronavirus in Nasarawa State. The State Director, Priscilla Gondolo, says the move is necessary to keep the people alert on the reality of the pandemic now that schools have reopened.
Ladies and gentlemen, you will also agree with me that government at all levels has taken the most difficult part to opening schools for exiting classes. We all know that it will involve the movement of millions of vulnerable young people across the country. It is in this regard, coupled with the nonchalant attitude of the general public on the pandemic, that the National Orientation Agency, Nasarawa State, is organizing this mega motorized awareness sensitization campaign on COVID-19 to alert the masses on the existence still of the pandemic.
Well, 6 months into the fight against COVID-19 in Anambra State, Governor Obiano is telling residents that this is not the time to drop their guards or disobey COVID-19 protocols. He also sounded a note of warning to traders and those conducting burials and marriages to adhere to the protocols or risk arrest and prosecution. Over 300 people caught without wearing face masks have been prosecuted at mobile courts in the state and made to pay both 10,000 naira fine and undertake community service. The governor also encouraged people to get tested.
Our best chance of surviving this pandemic still depends on our ability to prevent it. This is why we cannot afford to disobey the COVID-19 protocol. I'm also using this opportunity to warn the people in various markets. If I receive any notices that you are lowering your guard in any of the markets, I will close down the markets indefinitely.
Well, back to the schools in Delta State. The Commissioner for Basic Education, Patrick Uka, is impressed with the school's level of compliance ahead of examinations, but he is not too happy with teachers who are not strict on students who still mingle with their peers despite the trainings they got before the resumption of schools. The Commissioner stated this when he visited 2 public schools in Asaba to assess their level of compliance. He earlier visited an ongoing school project at junior staff quarters, which he says is in line with government's targets to ensure easy access to education, as well as to decongest schools in the state capital with large number of students.
I'm impressed. The consciousness of wearing the mask is there, but some expected. At times the children want to run to stay close to their friends and what have you. So there's need for the teachers to be constantly around to make sure they maintain those distances. But from what I've also seen is that they are prepared for the exams. Exams will be starting on Monday, and this is just other officers are going around other parts of the states to see how prepared they are. And you can see some of the labs we entered, they've already done their simulation on how they'll be able to take care of the crowd with the 3 labs that they have. And I'm equally impressed with that. And I can see some of the students demonstrating it, which means that the confidence is there. So I'm happy about it.
Well, here in Lagos, as part of efforts to complement government's effort at containing coronavirus in the state and by extension, Nigeria, Reddington Hospital Group has commissioned the Armoured Shield Medical Center and Zain Lab PCR Laboratory to take care of all COVID-19 related cases. At the event in Lagos, the State Commissioner for Health, Professor AKIN ABAYOMI, describes the Armoured Shield Medical Center as a great example of partnership between government and private sector, adding that the facilities have gone through rigorous screening processes and have been accredited for testing, treatment, and management of other comorbidities presented by patients.
This gathering is necessitated by the common goal to fight COVID-19. Members of the Reddington Hospital Group and officials of the Lagos State Ministry of Health are here to see the birth of Zain Lab PCR Laboratory and Armoured Shield Medical Center, both facilities under the Reddington Hospital Group.
Based on a needs assessment survey among our corporate clients, the management of the Reddington Hospital Group designed and proposed the Armoured Shield Medical Center as a medical program to provide an end-to-end seamless delivery of care against the COVID-19 pandemic for our corporate clients, their employees, families, including children and pregnant employees.
The Reddington Hospital established the Armoured Shield facilities in different locations in Lagos, away from all our facilities and branches, to give comfort to all our patients that they can now safely access care in these facilities without the fear of COVID.
It's not a day for long speeches as a special guest of honor, who is the Lagos State Commissioner for Health, Professor AKIN ABAYOMI, launches the Zain Lab PCR Laboratory and Armoured Shield Medical Center for COVID-19 testing and treatment.
This represents the command center.
This place keys into our strategy very nicely because there are many segments of society that still would rather not go to a public health facility. Now, we don't want to stigmatize that group of our society, so it's important for us that we team up with the private sector to provide an environment that some Lagosians would prefer to go to. It's taken 2 months to get this place ready. It's 100% accredited. Every test that's done here, we're really confident about the results, and we keep coming back to check. So it's not just a one-off thing.
The primary thing that makes Armoured Shield different is that as a healthcare group, we not only do treatment, but we also test for the virus. So essentially we have end-to-end treatment plan.
What they think they want to see. The new medical center, built in phases, offers PCR testing for COVID-19, 50-bed private isolation wards, computed tomography or CT scan, high dependency and level 3 intensive care units with state-of-the-art equipment and a multidisciplinary panel of specialists.
We have 2 high dependency rooms as well as 2 ICU units. So for the ICU unit, which is a level 3, we have things like the ventilators, of course, your BiPAS, your BiPAP. You also have your gas analysis machine. So one of the things we have, which is a unique feature from all other isolation centers, is the HEPA filters that we have. Now this is just the exchange of air. This way, the people who are taking care of the sick would actually not get sick too. Apart from that, we have the operating room and a delivery suite.
We have a team of doctors that have been trained in critical care response. We have also nurses that are trained in critical care and providing not just level 1 ICU care, but also level 3 ICU care. We've got midwives in our group because we have a theater here and we have a delivery suite. We have theater, peri-op nurses, we've got surgeons, we've got pediatricians in case we have a woman that delivers and the baby needs intensive care. And we have a machine here that is the CRRT machine. What it means is continuous renal replacement therapy. So when patients have such problems, we have a nephrologist on board to take care of them. And knowing what COVID is, we place the highest premium on infection prevention control.
The Armoured Shield Medical Center also has a COVID-19 command center with 24 hours telemedicine and emergency ambulance response. Yomi Otaibi, Channels Television News.
Nigeria, like other countries in the world, is faced with a very present health emergency, COVID-19, and countries have since realized that the best way to win this battle is by strengthening the health system, especially access to quality health care. Well, here in Nigeria, the NHIS has been given that mandate, and this afternoon we're being joined by the Executive Secretary and CEO of NHIS, Professor Mohammed Sambo. He joins us from our Abuja studio. Well, good afternoon, and thank you for joining us. The question is, how has NHIS fared in this COVID-19 era, especially with the attendant challenges?
Yeah, good afternoon, viewers. I want to thank you once again for having me in your studio. COVID comes in an epidemic and pandemic manner. That is to say, it was a disease that was not expected. It was not. There is no any plan for it at the time when it struck. So normally, when there is an epidemic or pandemic, all the institutions that are responsible for the control of epidemics will come into play. In Nigeria, if you look at the public health arrangement, you have the Federal Ministry of Health at the federal and state level, and you also have the National Center for Disease Control, NCDC, which is an organ responsible for the control of epidemics. If the epidemics is a small one, ordinarily NCDC would have been allowed to handle it to a logical conclusion. But the COVID, not being a novel virus, novel disease, and it came in a very big momentum, there is need for other agencies of the government to come to support in the control and combating these epidemics.
Right.
And that is why health insurance is not also left out in that process. When you want to even support in any kind of in any situation of this nature, you have to also realize your core mandate. The National Health Insurance Scheme is an organ that is responsible for strategic purchasing of healthcare on behalf of the employees or beneficiaries.
Right.
We have the responsibility to ensure that people have easy access to financial healthcare services.
Okay, Professor
So,
Sambo, if I may butt in now,
yes.
we'll explore some of this mandates, especially enrollment at this very, very critical time. But we need to go to break right now. When we return, it is rush hour for UK travelers as they hurry to get back into the country on time. We'll tell you why in a moment. Please stay with us. You're welcome back. Let's rejoin Professor Mohammed Sambo, the Executive Secretary and CEO of the NHIS. He joins us from our Abuja studio this afternoon. Well, thank you for your patience. Now, we're talking about the roles of the NHIS. Obviously, this pandemic has raised health awareness amongst Nigerians. Now, people take their health more seriously. But it turns out that the NHIS is not enrolling for now, and that's a huge concern. The big question is, why?
NHIS is enrolling for now. Yes, is enrolling. In fact, by Monday, we have a batch of a lot of enrollees to be enrolled within our ecosystem. Even with the COVID pandemic, NHIS has not ceased enrollment of its prospective enrollees.
Because I'm looking at...
We have not only been doing enrollment, but we have been doing other activities that will deepen the process of combating COVID.
Because this is a statement.
If you look at the role of NHIS during COVID.
Right, in just a moment, please. I want to refer to a statement on your website. And I mean, he gave out some of the protocols for COVID-19 in this area. And he says that in view of the current situation, all enrollment services are suspended till further notice, saying that all the NHIS contact numbers should be kept functional. But from that statement, it says that enrollment has been suspended. So I'm thinking, when did enrollment begin again? Because Nigerians want to know.
Yeah, I think you are referring to a document that was that came out as the initial stage of COVID, when there was a lockdown. But when there was a lockdown, and nobody knows exactly what was supposed to be going on. But when the things started stabilizing, we continue to enroll. Our ICT system has been patented and is activated for enrollment for public sector as well as private sector. It came at the time when we were actually upgrading our business process, automation of our business process. But the enrollment has continued. We enroll new. We continue to enroll the new enrollees. We continue to enroll the additional dependents, and we continue to enroll people from public and private sector. Okay. So at the initial stage of COVID, there was a lot of circulars.
You know, Professor Sambo,
in conformity with protocols that was developed by the by the presidential task force.
Okay,
but
Professor
immediately after that, some MDS were exempted from being under lockdown. And NHIS was one of the agencies that was exempted.
Okay,
so we continue our business activities without without further delay.
Right.
But,
just to,
in the subsequent circular, we
Professor
ensure
Sambo,
that when the enrollment is taking place, all protocols that has to do with COVID prevention are observed, such as social distancing, wearing face masks, and wherever we do our enrollment at state and federal level, we ensure that we abide by that protocol.
Right. You know, I keep finding a safe place to come in just to clear the air because a lot of Nigerians are interested at this time. So what I did was I saw that statement and I was thinking maybe things have changed. So I put a call through to the Lagos scheme this morning, and the information that I still got was that the NHIS is not enrolling for now. So maybe there's some mix-up there. But you might also want to add, I remember the Minister of Health referenced plans for an improved service delivery from the NHIS in light of COVID-19. So I wonder, does it mean that for future, treatments, COVID-19 will be covered by the plan?
You see, it's very difficult because COVID-19 comes in an epidemic. It will come and go, and if it goes, it is no longer it ceases to be a disease of public health importance. And it is very difficult to be inserted in the benefit package of the National Health Insurance Scheme. Usually, diseases that come in epidemics, they are usually tackled within the public health system of a country, and that is why we have NCDC. That is where we have various departments of public health systems.
Right.
There are NHS work on a balanced benefit package. Balanced benefit package in the sense that the public health envisages that some diseases come in epidemics. Right. And if you want to even cost them, it might wipe the little funds that is within the National Health Insurance Scheme. Okay. So, and these epidemics, they are national security issues. They are health security issues, and therefore they are entitled to a special budget if we want to have a very stable society. Because I think that's a great place to anchor. We're talking about health security, and COVID has posed one of the health security challenges. Therefore, there should be adequate budget to take care of it.
Right. Would like to thank you so much, the Executive Secretary and CEO of NHIS, Professor Mohammed Sambo. Thank you for your thoughts this afternoon.
Yes, thank you.
Well, perhaps more than any time in the world's history, the COVID-19 era has presented nations with the need to collaborate, sort of compare notes on fighting this common enemy. And today we turn our attention to Germany, where there's been some interesting new research on how the virus threatens to exacerbate social and economic inequalities. DW correspondent from Berlin, Chelsea Delaney, joins us now to tell us about the findings. Well, good afternoon, and thank you for joining us. Well, the big question now will be, has this virus actually brought Germans closer together, or what?
So this study really showed a big split in society. On the one hand, many Germans have come out of this feeling much more confident in society. So we've seen, the trust in the government go up quite a lot. The German government has gotten a lot of praise and a lot of recognition for its efforts in controlling the virus, particularly in the spring and early summer. So we have seen people just generally feeling much more confident that the government is functioning and is protecting them. And we've also seen through this study, interestingly, people feeling more that their fellow citizens really care about each other. So they did this survey in the beginning of the year before the virus outbreak, and about 40% of people, 20% of people didn't feel like that anybody in society really cared about each other. And we've seen that number really come down throughout the crisis. So for some people, they really have been able to really connect with their families again, or feel more of a social network in their lives throughout this crisis. But that's really limited to only a part of society. So the increases we've seen in social cohesion have really been focused on middle income people who are already pretty secure in their lives, and also we've seen these numbers really go up more among men, among white men. So these certainly aren't being felt equally across society.
Clearly, it's a mixed bag with COVID-19. But thank you so much, Chelsea, for that insight. Well, thousands of holidaymakers have seen their plans thrown into chaos as the UK imposes quarantine measures on France from Saturday. The 14-day isolation requirement also applies to people arriving from the Netherlands, Monaco, Malta, Turks, and other regions. People still in France are now scrambling to make their way back to the UK before the quarantine hits in the early hours of Saturday morning. Well, that's the COVID-19 update for this afternoon. Thank you so much for watching. I am Kayode Okikiolu. To stay safe.